in Kenya, our home country, is something that has not been given that priority. And now we have come to talk about it. Mental health. We begin.
So, I will be talking about stigma and mental health prevention strategies. So, stigma is a major issue when dealing with the treatment of mental health disorders in African societies. When somebody has mental health issues, they are dissociated from the community and nobody really wants to engage with them because in African society, they associate mental health disorders to witchcraft as its major source. So many people don't want to engage with you because they feel like engaging with you can also give them the same conditions that you are experiencing. So people with mental health issues in Africa are really dissociated from the society and isolated, and they have nobody to turn to for help. Mental health prevention strategies can include: number one, maintaining a healthy lifestyle by eating healthier diet and engaging in exercise. Number two, it can be avoiding substance abuse, since substance abuse can lead to addiction, and this can lead to other mental health disorders such as depression, which are usually hard to get over. And number three, we can also build social connections. When you're surrounded by many people, it's hard for you to have that sense of loneliness or feel like you need to distract yourself by doing drugs. So when you're surrounded by many people, you're also able to confide with them on matters that can really affect your mental health, and this can also lead to a good mental health in overall. And number three, you can also seek early intervention. So when you notice that something is wrong with you, or when you notice some symptoms of mental health, you can go to a mental health professional and seek help before the mental health condition gets worse or becomes too severe that it's hard to deal with.
Something else we want to talk about is mental health financing and mental health advocacy. First, to begin with, financing is something. What I want to tell us is that even in our normal budget drawing and in our normal expenditure, as we finance the things of our life, paying bills, we start with those things which are basic and which take priority depending on how important they are. And this issue of mental health is something that should be taken with priority because it is urgent, something that need urgent address. All of us that we need to, therefore what I can want to say is that we need to put into consideration as we draw our budgets, be it in the parliament, in the national fundings, in the county, and all at all levels, that money and enough fund should be set aside for mental health. Next on mental health advocacy is that this is something that is affecting all of us, that is not only an issue of those who are infected or those who are suffering with mental health ailment, because it is something that is affecting all of us, and therefore all of us need to advocate for mental health well-being at all levels, everybody, from leadership to the societies and to families and all cycle, that is something we need to advocate for. In advocacy for this, what we need is to have information and knowledge, because actually you cannot advocate for something you are not aware or you don't know what it is. So it's important that we all get involved in this, because when we come together in unity and our voice, make our voice stronger, is when something can be done, and it should be taken with greater seriousness than if only one person or a few individuals are left to do it.
We all know that mental health is the crucial aspect of our well being. And every individual should be in the correct mental health state. For one to be diagnosed with a mental health disorder, you have to go to a mental health facility or a health facility where you'll get a properly trained professional, a healthcare professional like a psychiatrist who will run some tests on you. And through the test, that's when you will be diagnosed. And if your mental health state is not in the correct state, that's when you'll be diagnosed to have a mental health disorder. And after being diagnosed, you need to go through some treatment. This treatment can be through counseling, can be through medication, and treatment does not only depend on counseling. We all need a good support system from our friends, our loved ones, and the society. One with a mental health disorder need to get a proper support system from the society. These professional health cares have come a long way to understand the treatment, recognize and identify various mental illnesses. When they have a better understanding of these conditions and the impacts they have in your life, treatment is followed after diagnosis, and this treatment should not only be effective but accessible to those who need it. Therapy, counseling, and proper medication can help individuals live fulfilling lives, contribute to the society, and break barriers that prevent people from seeking help.